These organizations, I think, should retract their statements and should really issue a solemn apology to the American public. They don't want disruption. They don't want tech monopolies to get access to health records. You're actually being a detriment to people's healthcare. These organizations are supposed to be here for the patients. They're basically saying that patients are stupid. Continuing on with Apple and now health records. So this article here was just in the New York Times, and it's saying that Apple Health has now made a big push to get access to the EMR, which is the electronic medical record. Fellow from the government here, it's this guy, Dr. Don Rucker, the Federal Health Department's National Coordinator for Health Information Technology. Okay. He said that the idea is to treat medicine as a consumer service, and that they want to give people convenient access to their medical data so it helps them better manage their health, seek second opinions, and understand medical costs. This is major, major, major. He said the provision of healthcare will be brought into the app economy, and through that to a much higher degree of patient control. And what's happening is the nonprofits, the American Medical Association, the American Hospital Association, are not happy about this. The American College of Obstetricians and Gynecologists, they're not happy about it. These organizations, I think, should retract their statements and should really issue a solemn apology to the American public. And here's why. I bet if we analyzed who is actually funding these nonprofits, I bet a lot of money comes from the incumbent healthcare companies. I bet hospitals. I bet healthcare IT companies like the Epic and Cerner that we've spoken about at length on this show. Pharma companies. It's all the status quo people. I bet the CVSs of the world and the health insurance companies. They don't want disruption. They don't want tech monopolies to get access to health records because they know that that will be a nice wedge to blow up these walls that these incumbent companies have been able to build up around data and healthcare. And why this is so frustrating to me is because it's actually putting Americans' lives at stake. And not only is it increasing the cost of care, which is a huge problem in this country, but you're actually being a detriment to people's healthcare. You're actually causing people to get less care that they need. And this point should not be taken lightly, okay? These organizations are supposed to be here for the patients. This is their argument. They're basically saying that patients are stupid and they don't understand what the large tech monopolies will do with their data. So what they want to do is say, oh, we need to create committees and we need to make sure that if the patient says, I approve for my health record to go into Apple Health Kit, right? So this is the patient giving their explicit permission to give the health record into Apple Health, okay? These health nonprofits are saying, well, no. Consumers don't understand what they're getting themselves into because then the large tech companies could go and sell this data. And so we need to protect the consumer. Wake up, guys. It's 2019. You think every other day there isn't a story about Facebook and Google and now, 50 states going after them for privacy violations? You think that consumers don't understand the implications of what happens if they give their data to Apple? You really think that patients and consumers are that stupid in this country? You need to give them the right to choose. And if they say, share my data into Apple Health, share it. Don't create all of these, muck up the whole process, probably have years of committee meetings, put all this regulation into place. And this is exactly what the healthcare industry has been doing for decades. And this is exactly why no one can get access to the health record right now. And this isn't just Epic and Cerner, but you can see the establishment. You can see the incumbents. And I guarantee these health nonprofits are absolutely biased. I guarantee that these health nonprofits are taking money from the incumbents. And that's who's really driving this. The incumbents don't want tech monopolies to get access to your health record. And just on our last episode, we basically documented how there are hundreds of billions of dollars worth of value if you can build a developer ecosystem around health records. And why Epic and Cerner and incumbents have not been able to do this so far, they don't want it to happen. They may say they're trying, but they don't want it to happen. And I give Allscripts. I believe Allscripts is the one that just did a deal with Apple Health a couple weeks ago. So Allscripts is an EHR, an EMR, right? So electronic health record, electronic medical record, they're interchangeable. So Epic and Cerner, on our last episode, we said, hey, Epic and Cerner control 58% of the EHR market. Allscripts, I think, was number 5. Apple did a deal with Allscripts to get more easy access to the health records in Allscripts. So you can see these deals happening, right? Apple's trying to make deals on its own. The actual government guy, this Don Rucker guy, he's got it right. For once, the government has it right, okay? We got to give this guy Don Rucker support because, yeah, here he is, Dr. Don Rucker of the Department of Health and Human Services. I guarantee this guy's world is blowing up right now. I guarantee this guy is not having a happy life right now because everyone's going after this guy, and I bet he is under immense pressure. So if you're on Twitter, let's find Don Rucker. Let's show him our support. Let's explain to him that he's got to keep on fighting the good fight. And oh man, these health nonprofits should really feel guilty. These health nonprofits, their executive leadership should really take a good, long, hard look at themselves in the mirror and really think about why they took the job that they have. Because what they're doing right now, trying to prevent consumers to get easy access to their medical records, I mean, what world do we live in? It's ridiculous to me. It's beyond ridiculous. So anyway, you can tell I'm a little passionate about it. It's people's lives at stake, okay? Not to mention huge money and huge opportunity. Hi, this is Alex Mozed. Thanks for joining us on Winner Take All. If you enjoyed the content today, which I bet you did, please comment, subscribe, and definitely message me on Twitter when we're doing live streams. Also, please note, all opinions expressed about stocks or public companies on the show are exactly that, opinions. This is not investment advice. Don't act on it. WisdomTree licensed Applico's Platform Insights data product to aid in the creation of the PLAT ETF. Thanks for joining us.